Good morning, everyone. My name is Trish Becca, and I'm the Senior Nutrition Program Manager here at IFINS, the Institute for the Advancement of Food and Nutrition Science. Today, I have the honor of moderating this webinar called Lessons Learned, Opportunities and Challenges to Monitoring Sodium in the Food Supply. This webinar is the third in a series of 7 free webinars and an invitation-only expert convening at the culmination of the series. The project is part of a broader IFINS effort to promote the understanding of what's new about the many roles of sodium in diet, health, consumer preferences, food safety, and quality. This work was supported by the IFINS Sodium in Foods and Health Implications Committee, and you can learn more about the series by visiting our website at ifins.org and click on Sodium in the Food Supply webinar series. For those of you that are new to IFINS, IFINS is the Institute for the Advancement of Food and Nutrition Science, and we mobilize government, industry, and academia to drive, fund, and lead actionable science in the areas of food safety and nutrition. We catalyze the creation of scientific knowledge, and we convene external researchers and experts to support positive change. And our collaborative and inclusive structure empowers members to bring forward their diverse perspectives of the entire food and beverage ecosystem. Before we get started, I want to go over how you can ask questions. So some of you will see this screen on your GoToWebinar. The orange arrow is how you expand and collapse the control panel, and the gray area for questions is how you ask questions. Questions are only viewable by IFINS staff and not other attendees, and there will be time to ask questions and address those during the Q&A period at the end of the webinar. Some of you may have an older version of GoToWebinar and may see this screen. The same thing applies. You ask questions, and they're only viewable to the staff. As a reminder, IFINS is a continuing education provider with the Commission on Dietetic Registration, and this webinar awards 1.5 CPEUs, and a link will be shared with participants after the webinar to access your CPEU certificate. So let's get started. Our first speaker today is Dino Cavone. Dino Cavone has over 20 years experience with the federal government and joined Health Canada in 2006 after spending 4 years in the Canadian Food Inspection Agency. Dino is the Chief of Nutrition, Regulation and Standards Division in the Food Directorate and oversees policy and regulatory development. For over a decade, he has worked on a wide range of legislative and regulatory files, such as nutrition labeling, front-of-pack labeling, and amendments to the Food and Drug Act. Dino holds a Bachelor of Science with specialization in cell and molecular biology from Concordia University and a project management certificate from the PMI Institute. Please welcome Dino.
Thank you, Trish. Thank you to IFINS for inviting me here today to present on this very important topic for us in Canada. The topic of my presentation will be on sodium reduction, specifically sodium reduction targets, our approach, some of the challenges we've seen, and some of the lessons learned as well. So we have an obesity crisis in Canada, and not just in Canada, it's a crisis that spans the entire globe. So we know that poor diets are a primary risk factor for chronic disease. In fact, diets high in sodium, saturated fats, and sugars are linked to obesity, hypertension, and chronic diseases such as heart disease, diabetes, and cancer. So these risk conditions and diseases are now starting to show up in kids. In fact, 1 out of 3 children are now overweight or obese, and 2 out of 3 adults are overweight or obese as well. Diet-related diseases, including cardiovascular disease, some cancers, and diabetes, are now amongst the highest ranking causes of premature mortality in Canada. In 2019, about 34% of deaths from cardiovascular disease in Canada were attributed to dietary risks. Hypertension affects almost 1 in 4 Canadian adults, and this proportion increases with age. And hypertension is considered a leading risk factor for cardiovascular disease and premature deaths worldwide, and we all know that excess sodium intake is strongly linked to high blood pressure. There's been numerous initiatives in Canada to tackle this issue. It all started with the launch of the Healthy Eating Strategy in 2016, which included a suite of initiatives to improve the nutrition information and literacy, protect vulnerable populations, and also improve the food supply. Over the past several years, we've made significant progress, and I'd like to highlight some of those accomplishments we've made as part of that strategy. So first, in 2016, we published a revised improvements to the nutrition facts table and list of ingredients, which will help Canadians make more informed choices. And I'll speak to each of these initiatives briefly in my presentation as well. In 2018, we prohibited partially hydrogenated oils, which are the main sources of industrially produced trans fat. And we also revised Canada's food guide in 2019, which was highly embraced by health stakeholders, the public, and media. In December of 2020, we published our updated voluntary sodium reduction targets for processed foods to encourage sodium reduction in the food supply, and that will be the main topic of my presentation, which I'll get into details later. In July 2022, we published our new front-of-pack nutrition labeling regulations, and lastly, we're continuing to work on restricting advertising to children for certain foods. So in Canada, we've committed to meeting the WHO's 30% relative reduction in mean population intake of salt or sodium to 2,300 milligrams per day by 2025. Most of the sodium we consume comes from commercially processed and prepared foods. So I'd like to highlight some of these policies in Canada relating to sodium, which will aim to help reduce the sodium intakes of Canadians. So first, sodium is one of the mandatory core nutrients in the listed in the nutrition facts table, and its absolute amount in milligrams and the percent daily value must be declared on most prepackaged foods. And as well, Health Canada has enabled the use of several voluntary nutrient content claims, such as low in sodium, salt-free, no added sodium, reduced in sodium. And food manufacturers must meet specific criteria in order to use those claims, and those criteria are set out in the Food and Drug Regulations. In addition, there's one health claim, disease risk reduction claim for sodium and potassium with respect to specifically the reduction of risk of high blood pressure. So as I mentioned before, in 2016, we published revised regulations to improve the nutrition facts table. On the slide, you'll see on the right-hand side an updated nutrition facts table, which has several revisions. One is making the serving size more consistent and realistic. We'll also revise the daily values based on updated science, adding potassium to the list of mandatory core nutrients, which now must be listed below sodium in the nutrition facts table. We also noted, as you can see at the bottom of the facts table, footnote, which helps consumers understand how much sodium and other nutrients, such as sugars, are in their food, and it explains that 5% is a little and 15% is a lot. In January of 2019, we updated our food guide, and that included key messages such as choose foods that have little to no added sodium, sugars, or saturated fats, and prepare meals and snacks using ingredients that have little to no added sodium. As I mentioned before, sodium reduction is a key component of the healthy eating strategy. So in order to continue our efforts in reducing sodium in the food supply, in December of 2020, we released updated voluntary targets for processed foods. And I'll provide more details a bit later on in my presentation. In July of 2022, we published new front of package nutrition labeling regulations for prepackaged foods. And the front of package nutrition symbol includes a magnifying glass intended to capture the consumer's attention and act as a quick and easy visual cue for consumers to identify those foods that are high in sodium, saturated fats, and sugars. The front of pack nutrition symbol is meant to complement the nutrition facts table, and which is displayed on the back of packages, and it's really to help Canadians provide that link and make more informed food choices as well. If you look on the right side of the slide, you'll find an example of a front of package nutrition symbol and the nutrition facts table of a food that's high in saturated fat and sodium. In October of 2022, we also revised our daily values for sodium, potassium to be in line with the 2019 dietary reference intakes for sodium and potassium. So you'll see we've provided some details there on the slide. So for children 6 to 12 months, we've updated the DV for potassium to 860 milligrams. For foods intended solely for children 1 to 4, we've updated the sodium amount, the DV, to be 1,200 milligrams. And we've also updated the daily value for potassium to be 2,000 milligrams. And for any other case, the updated DV for potassium is now 3,400 milligrams. Just a note that regulated parties have until January 1st, 2026 to comply with the new requirements for front of package nutrition labeling and also the daily value updates that we've made. However, the good news is that we're actually starting to see some updated food labels that contain the front of pack nutrition labeling. So that's pretty exciting for us. So I mentioned that in 2020 we set our revised targets, but we actually started in 2012 with our initial set of sodium reduction targets, which was there to help reduce sodium sodium content in the food supply, but also for several kind of process-specific food categories. And at that time, we encouraged industry to meet those targets by 2016. The targets were based on a sales weighted average target for the food category and a maximum level target for individual products. The sales weighted average reflects product consumption better than an average because it really gives that weight to the products that Canadians buy more and provides less weight to those products that they buy less. We also set up intern phased-in targets that were really set up to encourage a stepwise gradual reduction. And in order to evaluate progress towards meeting those targets, we conducted a survey in 2017 on about 10,500 of selected prepackaged food labels, which at the time was a representative sample of foods collected across Canada. The label data that we collected was coded, analyzed, and adjusted for the market share, and it was assessed against the 2012-2016 sodium reduction targets. The evaluation progress of the evaluation of meeting the progress of those targets showed that industry met the phase 3 or 2016 targets in only 14% of the food categories, which you'll see in green in the pie chart. Examples of those products that met the phase 3 targets included cottage cheese, bacon bits, tomato paste, toddler mixed dishes. However, the categories that met the targets, the 2016 targets, which were the phase 3 targets, were not among the most significant contributors of sodium in the Canadian diets. Almost half of the food categories, which you'll see in red, made no progress, such as deli meats, frozen dinners, and frozen French fries. The remaining 38% of food categories only met the phase 1 or phase 2 targets, which you'll see in yellow and orange. And that included products such as cookies, cereals, vegetable juices, breads, crackers, hot cereals, and some canned vegetables and legumes. In terms of the saltiest products on the market, only 30% lowered their sodium content to the levels similar to other foods in that same category and met the maximum level target. We also published a report of the evaluation in 2018 on our Health Canada website, and that's also available if you're interested in getting that. So let's take a look now at some of the top sources of sodium in Canadian diets. So many foods contribute to sodium, as I mentioned earlier, in our diet, but our analysis determined that there were 6 food categories that were the top contributors of sources of sodium in the diet. So bakery products like bread, muffins, and cookies. We had also appetizers, entrees, which included pizza, pasta, microwavable dinners, and French fries. And the third largest category was processed meats like hot dogs, deli sandwich meats, hamburger, ham, and chicken wings. These 3 large food categories make up of half of the sodium that Canadians eat. Other major sources are cheese, soups, and sauces and condiments such as ketchup, barbecue, and soy sauce. So let's look at sodium intakes of Canadians. We know that Canadians still eat too much sodium. In fact, in 2004, Canadians reported eating an average of 3,400 milligrams per day. And in 2017, that number decreased to 2,760 milligrams, which is still too high. Health Canada recommends that most Canadians aim to consume 1,500 milligrams of sodium per day. An adult should not exceed 2,300 milligrams per day, which is about 1 tablespoon of salt, because that's the point at which we start seeing increased risk of chronic adverse outcomes. And specifically in younger children, they should limit their consumption intakes even more. So I'd like to take a minute to explain how we actually establish those average intakes for Canadians. So the average daily sodium intake of Canadians of 2,760 milligrams was established based on two criteria. One was the food intake estimates, and second is sodium levels in food. So for the first one, food consumption estimates were obtained for Canadians aged 1 year and older from the 2015 Canadian Community Health Survey, which is a national survey conducted by Stats Canada. The second was sodium levels observed in foods, which were taken from two data sets. The first was the food labels of over 10,000 branded products we collected across Canada in 2017 to get a representative sample of food categories with established sodium reduction targets. And the second was the Canadian nutrient file data, which is a standard reference food compositional database for all foods. Our evaluation showed that 3 out of 5 Canadians aged 1 year and older, and 3 out of 4 children between the ages of 4 and 13 eat too much sodium. Males actually have a higher intake of sodium than females across all age groups, and in fact, almost all males between the ages of 14 and 30 consume more than 2,300 milligrams of sodium daily. Women are lower across the board, mainly because they typically eat less food. Based on our analysis conducted in 2017, sodium reduction in processed foods only contributed to approximately 8% of reduction of intakes in Canadians. Therefore, at that time, we understood that more needed to be done to help Canadians reduce their sodium consumption. So in December of 2020, Health Canada released our revised sodium reduction targets for processed foods to be met by 2025. And the revised targets were really building on those that were established in 2012. Like the first set of targets, the revised targets continue to apply to processed foods sold in retail outlets and those destined for further processing, such as ingredients and ready-to-serve ingredients sold to restaurants and food service establishments. They have the same components, so there's a sales weighted average that applies to a category, and then a maximum level target that applies to individual items within a category. Most of the categories were maintained in the update. However, some changes were made where the category was found to be too general and there were specific challenges for some products or types of products. For the categories that were reorganized, depending on how the data was distributed around the average, the sales weighted average targets were either revised downwards or revised upwards. For most categories, the 2025 maximum level targets were set at the 75th percentile of the 2017 data to reflect the current market and encourage further reduction in the saltiest products within the category. We also set new categories for groups of products that are used in similar ways for products commonly consumed by Canadians. For example, we now have 6 new categories for groups of products within a similar sodium levels of the appetizer, sides, and entrees category, and now we have a new cheese category for Havarti and provolone. Overall, the adjustments resulted in an increase of categories from 94 to 117, and they cover now the majority of the sodium-containing processed foods in Canada. And for more details, I invite you to look at the revised sodium reduction targets, which are available on our website, and there's a link at the bottom of the slide. So this slide shows an example of the targets refinements for pantry breads. In this example, the previous category 1B, pantry breads and rolls, which is the purple box plot, was too broad, and the sodium distribution varied greatly between the various subcategories, as you can see in the green box plots. It's now been split into 3 target categories to provide more realistic and meaningful targets for those products. Using the box plots, we can see that there are corresponding targets. The corresponding targets were set relative to the 2017 measured levels. So for 1BA, the white pantry bread and rolls category, the first green box plot, you'll see the target increased from 330 milligrams to 360 milligrams, as the distribution of these products was slightly higher for that broader category. The maximum level of 520 milligrams was maintained as realistic for these products, and we didn't change that. For 1BB, the whole wheat and mixed grain equivalents, the target was maintained while the maximum level target was decreased at the 75th percentile to 400 milligrams for the category data. And then finally, For 1BC, the pizza crust category, the last box plot that you see there, both the sales weighted average and the max level were increased to reflect the sodium levels that we observed in those products. So I'd like to now switch gears and talk about some of the challenges that we encountered along the way. So monitoring the food supply and evaluating progress in reducing sodium in foods and intakes is actually crucial because it really encourages continued industry efforts in reducing sodium. So regular monitoring helps us evaluate the results of the targets, especially in the context of a voluntary approach. And this enables progress on reformulation to be effectively monitored. Comprehensive, representative, and up-to-date food compositional data are needed, including market sales data, but maintenance and cost of data are challenging because it's there's a big turnover of prepackaged foods on the market. So, for instance, the development of Health Canada's first set of targets, label data was collected by companies and complemented by an in-house collection of data and manual coding. And that was actually very complex and a lengthy process. For the evaluation and development of the second set of targets, we collected label data and food label data was collected and coded by an external firm, and that followed our specific plans and requirements, but that process was faster, but yet it was very expensive. So I'd like to also highlight challenges regarding the database management. So this database management is really labor intensive and also a lengthy process that can be even more challenging without the appropriate IT tools to support the analytics of market sales data and food label data. So the quality assurance needed to manage this process is also burdensome. Another challenge that we saw is that there's no scheduled future national health survey on Canadians' eating habits, and that creates a problem because the last set of collected data was from the 2015, and that doesn't really give us an understanding of the changes in food supply, especially the impacts of COVID-19 and the introduction of our healthy eating strategy. And therefore, the data might not be current and not reflect the consumer attitudes and eating habits, which may also have make comparisons hard for us as well. So I'd like to now talk about some of the lessons learned regarding setting and implementing those targets. So we learned that gradual reduction are important for consumer acceptance of lower sodium foods. Sodium is ubiquitous in the food supply, so targets should cover the majority of sodium containing processed foods, and also having up-to-date and representative country-specific data on food intake and food composition, as well as grouping foods into less broad and more specific categories allows for a more realistic and meaningful target. It's also important to have the two components that I mentioned, the sales weighted average and the maximum level. The sales weighted average is considered the gold standard. It better reflects the product consumption more accurately, and also it's better than a simple average, as it gives more weight to products that Canadians purchase more and less to those that they purchase less. A maximum level target for an individual foods in each category is also beneficial, as it actually encourages food industry to reduce sodium added to the saltiest products within that category. We also noticed that meaningful engagement and consultation with stakeholders in setting the targets, and also in understanding and addressing their challenges and finding solutions towards meeting the sodium reduction targets is important. Our scientists conducted extensive review and modeling to experiment with food categories and subcategories on how the data clustered within the overall categories to identify trends and outliers to determine a more appropriate reduction target and make the updates to the targets. So we held meetings with the commodity sector and meetings individually with food industry stakeholders, and that was really beneficial because it allowed us to identify some of the challenges they're encountering while reducing sodium in certain products. So some of the technical issues that they were having, and it allowed us to go back and change some of the categories and some of the levels. In terms of next steps, so we're currently conducting an interim monitoring survey in select staple foods categories such as bread products, breakfast cereals, processed cheese, soups, and tomato sauce. We will be collecting approximately 1,500 prepackaged food labels across Canada to get a representative sample. And the label data will be coded, adjusted for market share, analyzed, and assessed against the 2020-2025 sodium reduction targets. The survey aims to provide a snapshot of progress towards meeting the updated targets in those specific categories. We're planning to also conduct a more comprehensive monitoring survey like we did with the first set of targets starting in 2026. So we will do an assessment of progress towards those targets and subsequently progress towards the goal of the population intake of 2,300 milligrams as well. And finally, we will report post-2026 on progress made in all categories. So I'd like to talk about some areas before I end my presentation where we can collaborate when it comes to food label data and consumption intakes. So first, it's important to obtain sustained, standardized, and accurate, up-to-date food and nutrition label data for prepackaged food sold in Canada. But we think that this could be achieved by collaborating with industry stakeholders. This will help us, in turn, conduct regular ongoing monitoring of sodium levels and perhaps other nutrients in the food supply, and also help us evaluate progress against meeting the voluntary sodium reduction targets. This food label data is also useful for population level monitoring of food intakes and consumption. This is an area where collaborating with academics on the next national intake survey, for example, could be of great help. I'd also like to highlight that Health Canada has also worked together with the USDA on expanding the USDA Global Branded Food Products database to include Canadian products. As Kyle will probably mention in his presentation, the database is built with information provided voluntarily by food industry. And we think it's a really great way to share data and open data on nutrition and product labeling information. And we want to thank those data providers who have been participating in the pilot. We're starting to receive some Canadian products, and we look forward to publishing them in the Food Data Central soon. And finally, I just want to touch on education and awareness on sodium reduction, which is an important factor, and we believe is an area where collaboration among stakeholders is beneficial. So for example, we developed the education material and facilitated dissemination to help increase awareness of sodium reduction. So an example of that is when we partnered with College and Institutes of Canada, which is a national association for post-secondary colleges and institutes. And we worked with them to develop teaching material for food technology, culinary students, and food professionals to help increase awareness about implementing or the importance of sodium reduction in helping them reduce the amount of sodium that they actually use while cooking and also in the food supply. So the teaching material is free, and it can be used by colleges and institutes as well as by other professionals. So finally, if you more information is available on our website, and you'll see the link on that slide. Also, if you have any questions, you can reach us at that contact information. It's our generic inbox. And also, if you'd like to sign up for any of the consultations we have going forward on either sodium reduction or anything that we do here at Health Canada, there's a stakeholder information management system, which you can sign up for in order to stay informed on those consultations. So thank you. With that, I'll say thank you and welcome any comments here or questions you have.
You're on mute, Trish.
Oh, I'm sorry. Thanks so much, Dino. A great presentation, and we did receive a number of comments and questions that we can address during the Q&A period. So let's go to our next speaker. Our next speaker is Scott Brown. Scott is a Senior Director, Global Data Strategy at One World Sync. He works with brands, distributors, and buyers to build, implement, and utilize a harmonized global attribute dictionary for the synchronization of product content and images to improve the buying experience for organizations and consumers. He has spent over 20 years as the master data and product content expert, enabling companies to maximize value and increase market penetration. Scott serves as a chair of several GS1 work groups, Global Product Data Maintenance Group, and the Global Data Synchronization Network Operations and Technology Advisory Group. His efforts allowed for the adoption of GS1 master data standards by numerous industries, including food service, healthcare, and retail grocery. Please welcome Scott.
Thanks, Trish. Appreciate that. So I'm going to take a little slight different tack from what Dina was talking about. Dina was talking about all the efforts around reducing sodium and how we pull that through and the effects that it has on everybody out there. I'm going to talk about a different part of this issue and how we handle it, and ultimately how we handle overall issues, because sodium is just one component that can be changed in a product and amended in a product. And so when that happens, we have to go through the whole cycle of how do we manage the data and look at it over time. And so we have a lot of great information that's out there, a lot of things that are available, but what we want to do is try and figure out how we can work with that and how we can do it. So consumers, it's not really that difficult for them. At the end of the day, what's on the package is what they need to focus on. That's the source of truth for everything. But that doesn't mean that they aren't doing shopping. They aren't doing things online and looking for ways to be able to get that information and decide the products they want, sometimes even before they physically take ownership of the product. And when I say physically take ownership, it could be a delivery service, it could be they're in a store. But they really need to know what the product is. You know, what is it made of? What are the things that are inside of it? And then, especially when we talk about food products, what is that nutritional content, right? What's the sodium level? What is out there, so that I can now compare that and see how that fits into my diet. But then it goes even further around allergens or any socioeconomic things. So there's a lot of information that a consumer is looking for. And like I said, the bulk of it is on the package, but they are looking for it in some form of online research as well, because a lot of consumers are doing that research outside. Now, from the supplier or brand side, they are making updates to their product, and they're making updates either based on some type of regulation or something on a marketing side, or in some cases, it's just pure and simple, they're updating the packaging. I mean, if you look at this image here, not much of the products, there's some products here that we still see on the shelves today, but they don't look like this today. They still might be the same product inside with not that many changes made to it. But there are all these types of changes that they take into account over the life cycle of a product. And so they got to make sure that they are aligning those and pushing those through. So some of these updates that are out there, like I said, they're packaging things. It could be that some of these changes, when they come to a nutrient change, such as a change in sodium, might actually drive a new, what we call global trade item number, or GTIN. The consumer might know that as an EAN code or a UPC code on the side of a package. And so there might be times where it looks like it's a new product, but really it's just a redo of the existing product. And so they have to try and manage all of that as they go along and work with everybody inside the system to be able to pass it along. And as passing that along, a lot of them are doing synchronization of data. They're using some type of synchronization service. One of the most popular ones out there is the Global Data Synchronization Network, or GTIN. And that's how they're sharing the information. So as we go through and we look at changes to sodium in conjunction with everything else, we have to start paying attention to how we might manage those changes. One of the biggest things that's out there, as I mentioned, is the possibility that certain changes will actually drive a new product identifier. So suppliers have this tool that GS1 manages for the GTIN management rules. And there's 10 of them, and you go through and you answer these questions. And if you answer yes to anything, and granted, you have to go through all 10 every time. You can't just go through and, oh, I answered no to the one I thought I needed to, I'm good. You still need to answer all the others. If you answer yes, then you have to get a new GTIN. And that's what's going to drive some issues with change, drive some things where folks now have to start looking at the items in a historical perspective and in a relational perspective. So one of the big things about the management rules is, do you want the consumer to know a difference? If the consumer is expected to make a buying decision, then it needs a new GTIN. It needs something so that you can call out, this is this product and this is a new version of the product. You can compare the two of them. So things like if they are changing net content, if they are changing a major ingredient, to something else, if they're changing a brand name. Those are all big things that are going to drive a new change. But then it comes down to some of the gray areas, and sodium is one of those ones that falls into a gray area. If you change out the salt portion of your product from a NaCl to a potassium-based salt, so from a sodium salt to a potassium salt, that is an inline change, and the rules don't say you have to change a GTIN for that. Still have to change the side of the packaging, still have to change the nutrient panel, still have to do all of those regulatory things, but you're swapping out just one of the ingredients and it's still having the same effect, still being the same thing in there. Now, a supplier, to be a good supplier, probably should do that. It should call that out. So folks, the consumer can now make a decision or at least understand that the product is not what it was before. Because maybe they already made the buying decision. Maybe they already decided that that soup has way too much sodium in it for me. I'm going to now move on to something else. They make that formulation change, but it didn't change that identifier. It changed everything on the package, and now something needs to call out to say, hey, I'm new and different. I'm not what you thought I was. Come relook at me. And so sometimes having that new item number can help. But the biggest thing suppliers have to do is they have to weigh that change against how the retailers will handle those products. Because there are things that the retailer has to do, specifically when we talk about brick and mortar, around the shelf edge. And so there are some programs and fees and services that go along with making a GTIN change that the retailer and the supplier have to work out in conjunction with each other. But one of the things that is newer on the market and inside these synchronization tools has been there for a couple of years, and people are starting to get involved with it, is the idea of notifying people what the replacement is. So that's been the hardest part about all of this, is when you change a GTIN, how do you relate the new item to the old item? Everybody, on the supplier side knows because they had to make a change, and maybe the retailer knows and understands because they've had to make some type of change at the shelf edge or in their back end. But how do we let the consumer and others who are outside of that window know what's there? And so there's ways that the supplier can communicate, this item's been replaced by this other item, or this item is replacing this original item. And so that can be done through those synchronization messages that are out there. But at the end of the day, managing the change is always the challenge. Making sure people understand what's out there and how it relates to them and what's going on. And so to effectively manage that change, the suppliers need to make sure that they understand what they're changing and how it affects everybody downstream, and not just how it affects them. Making sure they communicate thoroughly and efficiently with everybody that's interacting with the product. That way, everybody is aware of what's going on. And then lastly, making sure that the product information that they share is the correct information regarding the change. Now, with that, understand that the old product and the new product, or old version, new version, might be in the supply chain at the same time, might be on the shelf at the same time. And that's why it's important to have that information out there so that people can understand this is what it is now. This is what's coming out there. There might be some mix in there. There might be a couple different product things on the shelf. At the end of the day, the packaging is always king for what that instance of that product is, but the information should be there. And as you go along, you're going to see these challenges start to dwindle as people start to understand how to do this and how to interact with it. But there's still, how do you follow the changes over time? If you're not the retailer, if you're not the supplier, how do you follow these changes? And so that's where the challenges with the change in an identifier or GTIN come in. And so having that identifier where you can say, hey, here's the replacement scenario, that now gives people the reference point to say, this item came from that other item. That's the other item. Now, the other thing to do is you want to look at history, right? As we go through a lot of these research, a lot of these things that Dino was talking about and others are talking about where they can look at things over time, require that they actually have some information, not only about what's current, but what's historical. And you can do that either by going in and getting information when you're doing a run, or when you're doing some type of analysis and storing that locally and coming back over time and storing instances of that. Or, as you'll hear Kyle talk about here in a few minutes, You can look at Food Data Central and other similar services like that that do have some historical records that are available that you can pull down and utilize. And that's how you can start to manage these. If you're not in that retail supply chain and including the brand, that information chain, if you're outside that information chain, that's how you're going to be able to pull these things in and be able to work with them. So at the bottom of all of this is sharing the information. And as I mentioned, data synchronization is out there. There's the Global Data Synchronization Network, which is the best way to be able to do that. But it also is incumbent upon the players in that space to look at what needs to be done outside of their walls and all the way down to the consumer. So the supplier has to be able to share all of the information accurately and timely. It doesn't help to share me good data 2 years after the fact. You want to have that good data out as soon as it's available and telling people when that product is going to be on the market. Those folks in the middle, the distributors, the retailers, the marketplaces like Amazon and Google and Bing and all these other marketplaces that are in the middle that you can buy product from, or that are moving product from point A to point B so that a consumer can buy them, they need to make sure that when they get that data, that they aren't sitting on it, that they take and they act on that data as quickly as they possibly can based on the time frame, right? If they're getting a change and it says this is going to happen 6 months from now, okay, that's fine. They don't need to actually go change a lot of their data until close to that 6-month time frame. But if they get it from a supplier and they say the supplier says it's valid tomorrow, they shouldn't wait 6 months to make that data available. Now, they got to weigh that against their inventory that's out in the marketplace. But for the most part, they need to be current and active with what's out there from the supplier. Now, the other thing about these middle people is they don't have to give the data exactly in the format that the supplier gave it to them, but it should be resemblant of that. And a good example is a supplier may send in a statement that says an item contains an allergen such as peanuts. Well, on the recipient side, instead of putting that statement of contains peanuts, they may have a radio button that has the word peanut and above it have the title allergen containment, and they put a check mark next to peanut because that's the way they want to interact with their consumer. The data is still related and relevant to what the supplier gave, even though the format is slightly different. So they need to make sure that the format doesn't alter or change the content that they've been given from a supplier, and they need to make sure it's timely. At the end of the day, the consumer is the one that needs to have the most current information about the product that they want to buy at any given point. When I say any given point, that could be in their online research at home, it could be an online ordering portal, it could be a delivery portal, it could be when they walk into the store and look at the shelf edge labeling, or maybe any placards or marketing material that they see in that location where they're buying. But at the end of the day, they are the most important piece to this, and they're the ones that need to do it. Now, the screens I've got here, or the images that I've got here on the screen, these are from our system. But there's any number of systems out there that can do very similar things. The left is our entry screen where people can actually go in and enter the product information and maintain it online. We have tools, and all the GTIN folks have tools that you can do this electronically from your back end. And then we can develop, and I've got an image of one of our products which shows you content that's available. All the way from the marketing messages, the feature benefits, nutrients, allergens, ingredients, all of this information is shared. And so it is just a matter of making sure you keep it current and you pass it along, and that the parties down the line take this information and continue to share it until it gets to the end of the line. And the last user is that consumer that is buying that product. So that's what I had to talk about today. I hope that it'll fit in well with what you're doing and can give you some guidance on how to manage this stuff over time and how to be cognizant of what changes can be out there and how they can impact you in what you're trying to do. So Trish, I'll turn it back over to you.
All right, great. Thanks so much, Scott. fascinating presentation, and there are a couple of very interesting questions coming through about the use of the GTIN for monitoring. So we'll get to that at the end of our webinar today. So now's the time to introduce our last speaker of the day. That is Kyle McKillop. Kyle is the lead on USDA's Food Data Central, which is an integrated data system that provides expanded nutrient profile data and links to related agricultural and experimental research. He has a BS degree in computer science and a master's in information management with a specialty in technology development and deployment. Kyle previously worked for the University of Maryland's Joint Institute for Food Safety and Applied Nutrition, where he worked on developing food database systems, including modernizing USDA's food composition database. Kyle is now with the USDA ARS Beltsville Human Nutrition Research Center, and he leads Food Data Central's data collection efforts and manages future application development. He's an active participant of the public-private partnership that works to expand the global branded foods product database, which is published on Food Data Central. Please welcome Kyle.
Great, thank you, Trish. As Trish mentioned, I am at USDA's Agricultural Research Service, specifically the Beltsville Human Nutrition Research Center, at the Lab for Food and Health of People and the Environment. As a federal employee, just a note that I have nothing to disclose today. So I'm going to be talking about the step after Scott today, which is the data coming into Food Data Central for branded foods. If you're not familiar with Food Data Central, it is a publicly accessible website at fdc.nal.usda.gov, where all the data we're talking about is publicly free tool to get access to this data. If you go to Food Data Central, though, the first thing you'll notice is there's more than just branded foods data at FDC. And I'm not going to go through these definitions. If you go through FDC, you can see and explore each one of these data types. But I just wanted to mention here that while all of these data types are similar and have related data, they're not necessarily interchangeable. And so today I'm going to be diving into the branded foods database, talking more about and expanding upon Scott's presentation about the presentation of the branded foods data within Food Data Central. To start off, I want to mention that this data is really because of a partnership for public health, the USDA Global Branded Food Products Database. It includes multiple partners, all who are experts in understanding manufacturers' needs, understanding academic needs, being able to pull and manage large sets of data to make them available. So this partnership is really successful because of the people involved. And if you go in to view branded foods data, we have some required attributes that you would expect to find on nutrient information. As Scott mentioned, we have the global trade item number, or the GTIN, that you use to uniquely identify a product. We include brand and product descriptions, so you know exactly what food we're describing. The nutrients, as would show on the nutrient facts panel, an example listed on the right. An ingredients list, serving size and standardized weight and volumes for serving size, specifically providing information in per gram and per milliliter amounts. Date stamps associated with current formulation and market country. As Dino mentioned, we have more than just foods sold in the United States market. We're working on expanding the market countries out to include products that are sold and marketed in different countries, including Canada. That's just the required attribution on FDC in branded foods. It also includes extended data attributes. So some examples of these might be additional food composition data, meaning nutrients that aren't necessarily on the label, package size information, statements that might be on the label, such as the caffeine statement or the not a significant source of. We're working on bringing other types of metadata that aren't even necessarily on the label, including microbial data, trade channel information, such as products that are sold for the child nutrition programs, and a lot more. And all I can say is really go in and explore the data that we have available. And And the partnership's been working to expand the amount of products in Food Data Central for branded foods. It originally launched at the GoDan Summit in 2016 with 100,000 products, and we're nearing up to 500,000 products in 2024. And to put this into perspective, we know last year the FDA issued a request for information on food labeling in online grocery shopping. And those information that's provided to the consumer when they're buying on an online grocery store, we've seen research over the last year that suggested that these information are incomplete or potentially inaccurate. And so the FDA is trying to get an understanding of what online grocery shopping looks like right now. And we know it's a large source of information for understanding nutrients on labels. And as Scott mentioned, going through the GTIN, syncing that data, and the challenges are going to be related to providing high quality data for consumers at the online grocery shopping point of purchase, excuse me. But what we're interested in at the USDA is taking data that's voluntarily submitted by these manufacturers and making them available for researchers. And so we're a research-focused database application to pull in this branded data and make it available for researchers. And so to talk about the data submission process, there were originally two ways to bring in branded food data. So if you go into branded foods today, it'll come from one of two sources. The first is through the GTIN, as Scott mentioned, the Global Data Synchronization Network. While the partnership and USDA uses One World Sync to specifically pull the data from the GTIN, manufacturers can use any data pool provider. It may be One World Sync or another to submit data to USDA. The other way that you might see data in branded foods was label scanned data. So in this instance, a package flat or label was scanned. They used text recognition to read the label, digitize the nutrient information, and then provided that forward to USDA. And that was the Nielsen IQ Label Insight data set. Unfortunately, the Label Insight data submission discontinued as of November 16th of last year, but we have ensured that any of the previous released data are still going to be continually available on Food Data Central. The caveat here is that this data set from Label Insight will no longer be updated. If you're a manufacturer that provides data to USDA, this might be a good time to check and see how you submitted data in the past and ensure that you're using a data pool provider to provide the monthly updates and continue to provide those updates through USDA into Food Data Central. The data coming in is pulled by University of Maryland, who standardizes, aggregates, and publishes a data format over to USDA for import into our program. As of today, using One World Sync to pull the data in through the GTIN and potentially future platforms coming in the future. So now I'm going to dive into the data. So those who are trying to use this data potentially for monitoring, it's important to understand a lot of caveats here. So this is my opportunity to explain what some of them are and what I think is the most important to focus on as you're going through and using this data. The first to note is that there's 4 dates that can exist on every branded food product. The first is the available date, which is the product when it was the record when it was provided by the manufacturer to One World Sync. So this is when they hand it off to One World Sync and say, you can make this available to USDA. There's a modified date, which is the date the product was last modified by the data provider. They might be going in multiple times to edit not only nutrient data, but other information in the GTIN. The discontinued date, which may be blank, but if it's not, it means that the product has been discontinued. Note that even if there is a discontinued date, that product may still appear on the shelf, we think up to a year after it's been discontinued. So check the discontinued date to understand if a product has changed. These 3 dates, the available date, modified date, and discontinued date, are dates that the data provider provides to us. Whereas the 4th date is a date that we generate. This is the Food Data Central publish date, which is the date that we first added or updated that record in the Global Branded Food Products database. So this is a date that we generate on our monthly updates. Now, when you go into a product, you can see that there is an update log potentially on the products within the data set. And this update log is every iteration that a food might go through, as Scott said, 1 GTIN. In the future, we hope that we might be able to update this as suppliers continue to use some of those features that Scott mentioned about being able to say what product has replaced a previous GTIN. But today, the update log is specific to the GTIN provider. As the product changes, we specifically look at data that we're collecting and if that data has changed. The product might be updated on other package information that we don't collect. That change wouldn't be shown here. So this is specific to the data we collect, and you can see in this example, the most recent iteration of the product is on top with previous historical iterations below. Again, as Scott outlined, as sort of a historical record of previous versions of the product. And we note here what change has occurred. I'll remind you the dates are important, so go into each one of these records and see when these products were updated and when they were made available to Food Data Central. Now note, if you're using the search on Food Data Central, that top product is the one that's going to appear on the search. If you want to get to historic data, you need to go into the update log for a product. You need to go into the API that we provide the data access to our database to get into historical records, or the number of downloads that we provide every 6 months in our download page. Now, when data is submitted over to Food Data Central, some of these validation steps are actually happening at the One World Sync level. The first is hard data entry validations, which are also known as errors, which are strict rules for data, for the type of data entered. And when these rules are not met, data submission is forbidden. So this might be a required field, such as an ingredient list. Soft data entry validations would be considered warnings, where the information is likely incorrect or incomplete. And when data is not met, this data submission is still allowed to occur and is going to be published in Food Data Central, but will provide a warning to the data provider that there's something they may want to double check or look at. An example of this might be a serving size not given in grams or milliliter. While we could convert that, we'd prefer the serving size being given in gram or milliliter so that we do not have to do the calculations ourselves. There's also outliers and profiling that occurs, and these would be given a warning. The soft data entry validation, this is data that might fall outside of typical product range and flagged for review. This might be a specific nutrient value that's above an expected range for that type of product. These checks can be implemented automatically, or also can happen as we manually review the data. We have a way of communicating back to the manufacturer when we suspect maybe a data entry error or an issue. It doesn't necessarily mean it's an issue, and so what we do is communicate that back to the manufacturer so they can inform us whether it's a correct value or an incorrect value. Some other notes here is a reminder that we update branded foods monthly. So anyone, any manufacturer that provides data by the end of the month, say by the end of January, data is pulled on February 1st and then made available in Food Data Central by the end of February. So we update these products monthly. Some of the internal assessments we've done on the coverage of branded foods is we estimate that it covers about 80% of US sales volume. Some notes about the data when you go in. There are a lot of exceptions with labels. So foods with no nutrient fact panel are not currently included in the branded foods database. This is something we're evaluating on how to bring in, and note these foods did not require a nutrient fact panel. Some common examples might be teas or coffees. There are exceptions at the nutrient level. Some products don't need to report added sugar. Some products don't need to provide the actual amounts, and they can just present the percent DB. Others don't have nutrients that would occur or appear in the not a significant source of claim. So don't go in expecting a value for every single nutrient. In some cases, for things like sodium, that should be on every product. But note that if there's a missing record, that information might be captured in the not a significant source of claim, or might be something that was not required to be submitted. The last caveat here I want to mention is data storage. In Food Data Central as of today, we currently store all of our data as per 100 gram or per 100 milliliter serving. And what that means is we take the serving amount in grams and we calculate that out to a per 100 gram or a per 100 milliliter serving so that it can be compared with like data in FDC. And I'm going to come back to that in just a minute. First, I want to mention that as of 2020, manufacturers should have changed over to the 2020 labeling, which has changes from the original label prior to 2020, and that the Branded Foods Partnership is reviewing these data, reviewing nutrient fact panels that have been provided or current active records that aren't necessarily been updated to the new label. And manufacturers will be notified if older data or an older fact panel seems to be appearing in the database. Moving forward, there are other ways that nutrient fact panels can appear. And so this is something that is not currently available in Food Data Central, but that we're working towards. Is a lot of times when you look at a nutrient fact panel, an example given here, there might be more than one column. So we can refer to this as dual column or multi-column format, and they provide information other than just the per serving amount. They might give a per container, they might give a per prepared, it might be a multi-pack of multiple items sold in one bag or box. We also see nutrient fact panels that can be provided in more than one language, in which the food description, the serving description, or ingredient list might be translated to another language. So these are things we're actively working on in 2024 to bring into Food Data Central. And so what that means is if I look at this data model, we currently provide this unprepared per 100 gram or per 100 milliliter serving that we calculate in our database. What we would like to do as we move forward this year is to continue to provide that value as some food composition tables expect, but to also provide the per serving values that have been given by these manufacturers. We'd require the unprepared per serving, and then it would be optional for manufacturers to submit a per container or a per prepared or a multi-pack information on a product. And then Food Data Central will not only provide the calculated per 100 unit servings, but also provide the as given as it would appear on the package per serving. So this is something we're going to actively move towards. The IFIN Sodium Committee, we're collaborating with to work on a project to actually validate this data submission process, where we take the data that's being submitted in the GTIN, comparing it with the package label images to validate that the data are coming in as expected. So it'll help us identify if there's any issues in the data submission process for these per serving values and columns, rectify any issues, and sort of communicate out that we're validating this process. And we hope to collaborate with some manufacturers to help us with this and with this validation. So I'm going to summarize a few key aspects here that I want you to take away from today. When you're using Food Data Central, the latest iteration of a product is what's available on the search, and it's unique by GTIN. Remember Scott's presentation. Previous historical iterations on these products are available in the update log on the application, which is a tab on each food. You can go into the downloads to see the previous iterations, or you can access them via our API. The dates on each product are important. The dates signify when a change was prompted by the data supplier and when the data was made available and was published in Food Data Central. It's important to understand those data caveats. Data is voluntary submitted labeled data through Food Data Central, which makes it very different than the other data types in Food Data Central. And also to note that we are reliant on the manufacturers to voluntarily submit this. Nutrition labeling requirements differ by food, and not only by food, nutrition labeling requirements differ by country. So as we expand to things like Canada, nutrition labeling requirements are different, so making sure we're managing that and communicating that as we provide that data forward in the future. Nutrient values are currently stored in per 100 gram or per 100 milliliter servings, though this is something that we're actively looking at over the next year to include the per serving amounts. And to manufacturers, I'll ask, does your company supply data to Food Data Central? With the data being voluntary, many manufacturers are already submitting data, but with the change in data supply, if you were using Label Insight before, then explore how to transition into using the data synchronization network in order to provide these monthly updates to Food Data Central. With that, I want to thank everyone. I want to thanks to the Branded Partnership who make this database possible. A big thanks to the Food Data Central team who help manage everything on the Food Data Central side. If you have a question specifically to Food Data Central, I provided a link here that you can use on the Food Data Central website to provide feedback, as well as my email address. Thank you.
Thank you so much, Kyle. And I'd like to invite all of our speakers to join us and turn on their webcam and join us for the Q&A period. So I'm sorry about that. Okay. All right. So we have a number of questions that have already come through. I think I'm going to start first, since Kyle, your presentation talked about how manufacturers can submit data. Could you or Scott provide an example if a manufacturer is already sharing data, their food label data through GTIN that is, fueling suppliers and retailers and that type of thing? What exactly do they need to do to have that data also flow through to USDA's Food Data Central?
I could start on that, Kyle, and you can jump in and fill in where I miss. If they already have their items in the network, all we have to do is do a second publication using the GLN, the recipient GLN that is set up for the branded food database. And it's just as simple as that. Now, there are some things that you're going to have to make sure that you meet as you go along in case you might have not already done it. So there's some validations that will run to make sure you have a complete set of content for the nutrient factor. We have a complete set of information that is needed to go up to Food Data Central. So if you haven't already done that, you might have to adjust your item to make sure all your content is there. But once you do that, it's just as simple as adding them on. Once you add that publication, anytime you make a change to that item, it should automatically flow over and be available for the process development.
So do most manufacturers that share data through your data pool provider, One World Sync, are those data updates automatic?
Yes, they are. So what will happen is the supplier, as they enter that change on their side, then it flows in and we pass that along to anybody that item has been published to.
Okay, so it's just a matter of them selecting USDA's Food Data Central as a recipient of their data.
At the very beginning, yes. Once they do that, until they actually withdraw it from them, any changes will go straight through.
Okay, awesome. Kyle, did you have anything to add to that?
No, just that manufacturers should check their data, make sure in Food Data Central everything come through okay. We do our own validations, but it's good to make sure that your products are syncing properly and the most up-to-date version of those in Food Data Central. We require the manufacturer to be actually updating these products. So if they're not going in and updating these products, then we're not providing the most recent information to our consumers, our users, and our researchers.
Okay, great. I think we'll go to Dina. We have a couple of questions for you. One was that you mentioned that sodium intake was less for females because they typically eat less food. And so can you talk a little bit about the correlation between calorie and sodium intake and the thought that perhaps education should be around lowering caloric intake to recommended levels versus just reducing sodium intake in foods?
Well, that's a great question. So yes, as I mentioned, in theory, sodium intakes are linked to caloric intake. So people eating more food usually have higher intakes of sodium. We do provide nutrition, the kind of dietary recommendations as part of the food guide, specifically on sodium, and we also provide information on, obviously, on the food labels that sodium content in terms of front of pack nutrition labeling. So products that are high in, really to help consumers make that informed choice to reduce their sodium intakes. But in terms of the regulating the amount of what, the intake of the caloric intake is not something that would fall under our purview. Like all our regulations are criminal in nature, so that's kind of left at the kind of medical supervision. But in terms of like sodium content and dietary recommendations, those are provided by Health Canada. So I hope that answers the question.
Yes, I think a follow-up to this at another time might be to discuss what agencies are responsible for education and what those messages should be. But we'll have other webinars that also address that. Another question for you, Dino, is related to gluten-free or grain-free breads. What category do they fall under for sodium? Because the respondent or the person who asked the question said these are usually higher in sodium than traditional breads. So do they have their own category, or are they lumped in with other breads?
Yeah, from my understanding is we don't have specific categories for gluten-free breads, but we did collect the data and they are typically higher in sodium, so we recognize that. So depending on the type of bread, whether it was, grain or the type of bread category that we have for existing categories, they would fall in those categories and they would be evaluated, and those levels will be taken into account when we're setting out the sales weighted average targets and maximum level targets. So they were definitely considered and recognized as being on the kind of higher end.
Okay, and then the last question for you related to sodium targets. How did you look at things like frozen pizza? Did you compare the frozen pizza to when you added up the values for crust, sauce, and cheese together, and did the values look different?
Another great question. So what we did for frozen pizzas is we basically compared the values of the pizzas that were available on the market. So we didn't do a comparison with different ingredients, separate ingredients. So essentially, the frozen pizzas that were being sold were used, and the sales weighted average was calculated based on those that were in ready to eat form, let's just say. So we didn't really do a separate analysis for the cheeses and sauces and different ingredients. So hopefully that answers the question.
Okay, great, thank you. A few more questions related to monitoring and the use of the GTIN. So Scott, how might the GTIN be used to monitor changes in individual products over time if it changes? And are there other data fields or codes or information that researchers can use along with the GTIN or a part of the GTIN to look at products over time? I know when we talk about monitoring, we're talking about monitoring the food supply. So that's different than monitoring individual products. But if the GTIN is going to change, how does someone know that the product today was the same product 5 years ago?
Yeah, so it is a little bit of a challenge, and that's where I was saying that the supplier needs to make sure that they are communicating what replacements an item has, and if we capture that over time, you'll be able to see, oh, this GTIN replaced that GTIN replaced this GTIN. Now, that's a newer set of attributes that are out there. So if you go to things that are 10, 15 years ago, it's going to be very difficult to do that. And you might actually have to look at either brand name or manufacturer part number or SKU number, those types of things to see where either it is exactly the same SKU number or maybe it's a variation of that. And in my own supplier days, we had an 097 was one of our main product lines. And then as we made changes, it became an 097A, an 097B, an 097 JCP, and had all these other suffixes that were put onto it, but it was still an 097. And so with that, you had the ability to do that. So you may have to dig a little bit at first until we get all the suppliers understanding that as you make these changes, start using these attributes to make sure that people know that historical connection and that pedigree, if you will. It was this version, now this version, now that version. But those types of things should be in there. I'll pick on one of that image I had of all the old products. The one right there front and center that I always used to like was Frosted Flakes. We know Frosted Flakes is Frosted Flakes is Frosted Flakes. The product name didn't change, even though the formula might have changed over time, and the image on the box or the size of the box might have changed. And there might be a lot of GTINs that are out there for Frosted Flakes in the various different pack sizes and things like that. So you can look at it sometimes across that product name as well as the GTIN to be able to get some of that.
I think just that very example highlights some of the challenges of looking at these foods and even identifying the current nutrition in the marketplace. Dino, a question for you about the use of AI. Has Health Canada looked at using AI to help assist in their monitoring efforts, and what are the opportunities and challenges there?
Yeah, we definitely use AI in terms of web scraping and to get that data, especially the data that's available online with some of our retailers. But the challenge there is that data is not necessarily updated. We don't know it's you know, where in point in time that data is being updated. So we can't really use that data in terms of monitoring, because we have to kind of compare what's on the market currently with that data, so that we still have to go out and get that physical label data, because we don't know how accurate or how up to date that information is when we're web scraping.
Okay, and then are your thoughts through the pilot with USDA branded foods that if you're able to get Canadian manufacturers to directly share their data with branded foods, that could be a data set that could be useful for monitoring?
Yeah, it's definitely one of the reasons why we've been involved with the USDA branded database and doing that pilot with them, because we think that there is merit there. It's just a matter of, can we get the volume of data that we need, right, to do that monitoring. I think that's the key aspect for us, is that, you know, right now there's not a high level of uptake, but if that kind of changes and we see more uptake and you see that volume increasing, then that would allow us to kind of have that information that we would need. But right now it's kind of like to be determined, I guess.
And that goes right into the last question that we have for Kyle. Obviously, this data is very important. And while the nutrition data for products is publicly available on the label, it's difficult for regulatory agencies, research scientists, and others to collect all that data versus like purchasing all the foods in the marketplace. So what efforts are underway, Kyle, to engage with manufacturers to encourage voluntary submission through GTIN or another data pool provider?
Yeah, I think that's the benefit of the partnership, right? All of the partners bring something to the table. All the partnerships have different types of relationships with these manufacturers that we're able to identify when the data exists in the system, but they're not yet moving that over to USDA. And so the partnership is actively engaged in these outreach activities to make sure that they understand the ease of which they can provide this data forward. And I think that's actively what the partnership is working towards increasing. As Dino said, in Canadian foods, we want as many products as we can, and it's going to be up to the manufacturers to remember, even if they have this data in the system, that they just need to click a check mark to be able to submit this over and make it available. So luckily, I think the leap is not that far. It's not that hard. They should have the information already formatted correctly with their data pool provider. It's just a matter of informing them about the data submission process and the impact that providing that data over can make for us.
Okay, great. And one last question. When can users of the database expect to see the data as provided by manufacturers, including the dual column label information? I know you said that effort is underway. Do you have a target for completing that or publishing in 2024?
Yeah, I can say at this point that we're planning for 2024. We do our major releases in April and October. but we want to make sure we thoroughly test and make sure we're providing this information properly before deploying. So we anticipate that in 2024, but as I said, we're actively going to make sure it's correct and accurate before we put it out.
All right, well, that's all that we have for today. Thank you very much, everyone, for your wonderful presentations. I just want to say that if there are any additional questions or you want to learn more about sharing your data with USDA's Food Data Central, or learn more about data pool providers with One World Sync or Health Canada's Food and Nutrition Regulatory Policy, please reach out to our speakers, or you can email me at trishsecca@ifins.org. You can also continue to engage with IFINS on our website or through our LinkedIn channel. And thank you all for your hanging with us today, and we'll see you next time. Take care.